Hey guys, what's going on? Welcome to my channel, Hairliciously. Make sure to hit that subscribe button if you guys are new so that you guys can follow my second hair transplant journey progress, as well as video topics covering current hair loss treatments in the pipeline. Make sure to visit my website at hairliciously.com to grab your microneedling devices to stimulate hair growth, my DHT blocking shampoo and serum, low-level laser therapy cap, hair growth supplements, and a few other products that can help for those who are suffering from hair loss. So if you guys have not watched my previous video, make sure to check that out because recently I just buzz cut my hair down using a number 3, and I'm pretty happy with how the hair has turned out. The density is amazing, the hairline design is on point, and I cannot be any happier with the results so far. So once I get a chance to go outside, I will give you guys a better view of the hairline, but I think today I have better lighting, so here's how the hairline is looking. But stay tuned and I will keep you guys posted. Anyway, I wanted to cover an interesting topic on finasteride today. Specifically, I wanted to look into the research of how finasteride can affect the accumulation of body fat. I've been doing some research and found out there's quite a few finasteride users who have complained about weight gain after using finasteride. There's been multiple posts on Reddit, on different hair loss forums, and just basically, you know, if you guys just do a search on finasteride and body weight gain, you guys can see a lot of some of the questions that people have been asking. Some people have been saying that they haven't changed their diet or exercise or anything like that, and the only thing that they actually introduced was finasteride into their regimen. So they are attributing that finasteride was the causation for increased body fat. And there's other people that are not really sure exactly what was causing their weight gain. So I wanted to cover this topic. And I'm pretty sure a few of you guys have noticed that I also gained weight over the past couple months, and that I also started taking finasteride 1 milligram starting a few months back. So I think that this topic would be relevant to dive into. And as far as what I've been seeing from my personal experience using finasteride, I haven't seen any changes as far as weight gain because of finasteride. And I'm only saying this from my own experience because it can, differ from each person. I've previously taken finasteride over the course of the past few years on and off, and I really haven't noticed any much weight gain from taking it. And recently, I'm pretty sure that most of my weight gain has been attributed due to my wife's pregnancy. And as some of you guys are aware, once your significant other is pregnant, they're going to get a lot of cravings, random cravings throughout the day, including eating at odd hours. So every time my wife eats, I always end up eating with her. And with the whole pandemic going on, there's no way to go to the gym or exercise. And I think that has attributed to the weight gain that I have seen in my experience and not from finasteride. And before I used to run, quite a bit. I used to run maybe 25, 30 miles a week, but that was also when I was a little bit younger. Now I'm going to be turning 32 in a couple months, and that's probably going to attribute to my slower metabolism. But there is no excuses. I am going to try to watch what I eat from now on and try to exercise at least by running or walking outside. Because once the baby is out, I heard that it's going to be game over. Anyway, let's go and look into some of the studies and scientific background and mechanisms of finasteride, of whether finasteride does indeed cause weight gain or not. The first thing that comes to mind as far as known side effects from finasteride is gynecomastia, which is commonly known as gyno or man boobs. And this actually goes hand in hand with weight gain, and I'll explain this in a little bit. There's a lot of people who have complained about this issue after taking finasteride. There's a study by the International Journal of Trichology titled Finasteride-Induced Gynecomastia, Case Report and Review of the Literature, revealed that a patient developed bilateral gyno 4 months after using finasteride 1 milligram per day. 10 months after cessation of treatment, the patient still had enlarged breasts with no apparent improvement. And there's a second patient who was 65 years old. He also developed unilateral left gyno after 2 months of treatment and stopped finasteride, which led to improvement. Major improvement after 2 months. But after a follow-up of 6 years after treatment, there was still slight residual swelling. And the same thing can actually be seen from different hair loss forums regarding multiple threats on individuals who have experienced gyno after taking finasteride, and it seems to be a common occurrence. And I'm not surprised because one of the listed side effects of propecia is gyno or swelling / tenderness of the breast tissues. It doesn't occur as frequently as it does for the sexual side effects finasteride can bring in a minority of users, but people do experience it, and it is a real side effect that has caused many people stress, and even to the point where they actually stop taking finasteride as a result. Some even say that about 10 out of 1,000 men using finasteride would develop gyno, and this is important because gyno and increased body fat or weight gain goes hand in hand, and it all comes down to the change in our hormones from taking finasteride. And as you guys are aware, finasteride is a 5-alpha reductase inhibitor that inhibits the conversion of testosterone into DHT. DHT is what causes hair loss, and this prevents most of the DHT from binding to the hair follicles, where it can actually cause miniaturization. And this is why finasteride is effective in slowing and possibly halting genetic hair loss in men. So when finasteride inhibits testosterone from converting into DHT, you are going to be left with a lot of circulating testosterone in the body. Testosterone is known to convert to DHT, but it's also able to aromatize into something known as estrogen. So with more circulating testosterone in the body from taking finasteride, there is going to be a higher level of estrogen in the body circulating. So basically, finasteride lowers DHT levels, but it also increases circulating testosterone and estrogen in the body. Now, this is important because it can cause hormone imbalances between the levels and ratios of testosterone and estrogen, therefore causing gyno as well as increasing body fat and weight gain and a plethora of other sexual dysfunction. There has to be an optimal amount of estrogen in the body, and if either goes too high or too low, it's going to screw up the body and cause unwanted side effects like gyno and a bunch of other stuff. Higher levels of estrogen is going to cause feminizing effects, including increased body fat levels as well as sexual problems. And in women particularly, fluctuating estrogen levels around menopause is going to cause weight gain, since estrogen helps regulate metabolism and body weight. So the most important thing to do before taking finasteride, and I've talked about this numerous times, in order not to just avoid gyno but also sexual side effects, is to get baseline blood test work done before taking finasteride so that you guys are aware of your hormonal profile. Specifically, you want to get tested for estrogen and testosterone levels and make sure that they are in the optimal range as your baseline once you start taking finasteride, so that you can kind of go back and see where your levels were prior to taking finasteride. And the other thing is, if your estrogen levels get out of range, you can actually take aromatase inhibitors, which basically blocks testosterone from aromatizing into estrogen, which in turn is going to lower the circulating estrogen in your body. It's going to bring it back to the optimal range, hopefully, to reduce side effects. And I will actually talk about this in a separate video and go more into detail. Anyway, that's all I have for today, guys. Hope this video has been educational. If you guys have any questions, please make sure to leave me some comments below. Finasteride can cause weight gain. So if you guys are suffering from weight gain, I would speak to a doctor. Make sure that you guys get the proper blood test done. And yeah, that's pretty much it, guys. Thanks for watching. Take care.